Now at 10:30, keep it here. This is the place for Let's Chat.
Welcome to Let's Chat, the Tennessee Valley's premier show focusing on lifestyle and entertainment. Bringing you smart shopping tips, community events, and the newest trends. Now, let's chat.
All the time we get to spend with Dr. Tom Devlin is good. Dr. Devlin, of course, runs the Neurosciences Division of CHI Memorial. Dr. Devlin joining us for a bit this morning talking about stroke care. Dr. Devlin, good to see you as always.
Fantastic.
Here in Chattanooga, we seem to have the highest percentage of strokes just about anywhere in the country. Is that still true?
Absolutely, Chip, and thank you for letting me stop in and just reminding everybody. There's three things they need to remember when they think about stroke. Number one, we are in the highest incidence of stroke anywhere in the United States. And
Why?
It's because we have a bit of an older population. You know, we eat a very fatty, rich diet. We smoke a lot, and we have a lot of obesity in our kids. So these stroke risk factors start very, very early in our population. So the key thing to remember when it's stroke is number one, you need to know the signs and symptoms, and the very best way to remember that is the word be fast. B, like the letter boy, E, so B-E-F-A-S-T.
Right.
Here are the signs and symptoms. Balance, B for balance. If suddenly you lose your balance. E is your eyes. If you suddenly lose your vision. F for face. If you suddenly develop a facial droop. A for arm weakness. And S for any sort of speech problems. So all you need to remember on the signs and symptoms is be fast, balance, eyes, face, arm weakness, or speech. And what does the T stand for? The T is there to remind you that time is brain. There is no more time-sensitive condition in all of medicine than stroke. So what do you do with it when it comes to time? It's very simple. You do one thing. Don't call me. Don't call your girlfriend. Don't call your brother. Don't call your doctor. Call 911.
Get to a hospital.
Get to a hospital. So be fast, signs and symptoms, number one. The second thing to remember very simply is that we have good treatment for stroke these days. It's not perfect, but it's good. And if you come to our facility very quickly, there's a lot we can do. So looking at the graph on the screen here now, what you see is there is Chattanooga. It's right in the epicenter of the stroke belt of the United States. That's why it's so imperative. Now, two, when it comes to the signs and symptoms, call 911, and when you get there, what are we going to do? On the second image, what you're going to see is really within about 10 minutes max, we're going to get all these images of your brain that you're going to see. We're going to see not only your arteries, we're going to see all of your brain tissue, and we're going to see what's alive, and we're going to see what area of the brain is not getting blood flow. But you have to remember, you've got to come to a certified center that has all this ability. So at CHI Memorial, we are a certified center to do all of this advanced therapy. So the second thing to remember is that when you get in the ambulance, ask them to take you to CHI Memorial, because many hospitals do not have the ability to look at your brain tissue, to look at the arteries, and diagnose the stroke properly.
You have been on the cutting edge of stroke care for so many years now. What's the next big thing as far as stroke, either cure or prevention is concerned, from where you sit?
And you know, this is the thing, Chip, I like to talk about most. And this is the thing I want our audience to really know. You know, Chattanooga has a tremendous history of really ushering in and pioneering some of the great treatments for strokes in the past. But at CHI Memorial, that's exactly what we're doing, and we're doing it in ways we never had imagined. So the third thing I want the audience to remember is that while we have good treatments for stroke with either clot-busting medicines or where we go up into the brain and grab the clots and pull it out, in a lot of the cases, the patients may not qualify for those treatments. So for example, the clot-busting medicines can only be given up to 4.5 hours after the onset of your symptoms.
Right.
So if you woke up with the stroke, you may not be a candidate to get a clot-busting medicine. So what I'm very excited about is also you need to keep in mind that the clot-grabbing procedures only work in about 50% of the time in terms of making people really normal. So the new therapies on the horizon are, number one, we are pioneering new clot-busting medicines that can be given up to not 4.5 hours, but 24 hours after onset of stroke symptoms.
Wow.
2, we're working with a number of new drugs that when given with the clot-busting medicines or with the mechanical clot-grabbing procedures may significantly improve your chance of having a good neurologic outcome. So there's many therapies, both drugs and devices, that we now are testing, and we're pioneering with the best scientists from around the world. So just very simply, 1, 2, 3. Know the signs and symptoms. BEFAST,
right.
balance eyes, face, arm, and speech. Number 2, you have to go to a certified center that is capable of doing this sort of imaging. And thirdly, it's important to realize that in many cases, the standard therapies are not going to be highly effective. So you want to be at a center that has the ability to give you treatment of some sort if you're not a candidate, and even if you are a candidate, you may get something in addition that may significantly increase your outcome of a good neurologic outcome.
We're going to have to leave it there, but we hope you'll come back and join us and talk more in the coming weeks about some of the exciting things that are going on at the Neurosciences Center.
Fabulous. Thank you very much.
One of the preeminent, if not the preeminent guys when it comes to stroke care anywhere in the world, especially here in the country. Thank you, Dr. Tom Devlin. Stick around. We have much more straight ahead on Let's Chat.